CVM 450 I represent. See it happen. You know the vibe. That syndicate. Oh.
It's Friday, June 21, 2024. Thanks for joining us for CVM News at Noon. I'm Nika Lewis. The 10th Biennial Jamaica Diaspora Conference ended on Thursday, and the event, based on reports, was well supported. Representatives from the diaspora believe it was a success. Speaking on Lead Story yesterday, Vice Chair of the Jamaica Global Diaspora Council, Dr. Shauna Chin, says the diaspora is an asset to the nation.
I think most importantly, one of the things is more than remittances, Jamaicans abroad, we have such large amount of intellectual resource to be able to provide and to collaborate with Jamaica. And that's one of the things we've been trying to say. It's more than remittances, right? We want to make sure that we come back. For example, on the Global Jamaica Diaspora Council, our former Global Jamaica Diaspora Council elected representative for the UK North, he has returned, Dr. Kevin Brown. He is now coming from UK in Rolls-Royce as an engineer, and he's now the president of UTEC. And so these are the things that we want to emphasize that we have coming out of the diaspora, is we come home and we give our intellectual resources as well, and that is where we want to collaborate, which is why United for the Transformation of Jamaica, helping Jamaica get to Jamaica Vision 2030.
However, the conversation about members of the diaspora voting was also a key takeaway from the conference. Speaking on Lead Story was Chairman and CEO of Blue Maho Holdings, David Mullings. He addressed those concerns.
Diaspora who say they want to vote because we send back so many remittances. And I have to say to them, the remittances are not sent to the government coffers, right. They're sent to friends and family. And regardless of who is in power or where Jamaica is, you're sending remittances anyway. So I think we should stop bringing that up on the diaspora side. And we are approached all the time for donations to the point we're almost overwhelmed. We're being begged constantly. So people see us as big wallets that they can go and try and take money from. And I think that has to change. You need to look at us as investors who want to deploy capital in Jamaica and get a return on our investment. With Blue Maho Capital, that's what I've been doing for 6 years, is investing in diaspora capital. Most of my investors are of Jamaican descent living here in the United States, and we're investing in Jamaica and the wider Caribbean in different ways. And now we're going to do it at scale. And I do think we will play our part in changing the way people think about the diaspora. But the diaspora has to put their money where their mouth is.
Northwest St. Anne Member of Parliament, the JLP's Crystal Lee, is slamming PNP spokesman on health, Dr. Alfred Dawes, for what she calls his hypocritical failure to acknowledge major steps being taken by the government. This as she contends the Andrew Holness administration continues to reform the healthcare system, which she says has suffered from decades of PNP neglect and maladministration.
Well, this government via Dr. Tufton has been transparent in its management of the ministry, and we have taken active and visible steps to fix the problems of resources allocation. And you know what? This is an emerging trend in the PNP. Their spokespeople continue to make misleading statements in their desperate bid for political power with no accountability or no regard for what is accurate.
Jamaica's first full-service technology company, Smart Mobile Solutions, SMS, has launched a new suite of software to help businesses become more efficient. Smart Tech 360 offers specifically designed innovative solutions to allow for greater cybersecurity, software development and web development. Speaking at the media launch of the service on Thursday, Minister of Industry, Investment and Commerce, Senator Aubin Hill, shared his full support, adding the implementation of smart technology is necessary for Jamaica's economic growth and productivity.
Digital empowerment is necessary. As the Minister of Industry, Investment and Commerce, Jamaica's business ministry, I am in agreement with and I'm committed to working with our agencies, and in our ministry we have 20 of those agencies and collaborating with other ministries and the private sector in driving our nation's digital agenda. Productivity is what SMS is about. And what we have to do in Jamaica, we're low on the scale of productivity. We have to raise that. But we took our debt from 147 to 72. We can do it.
The years-old question, where do the thousands of dollars paid for traffic violations go, may have been answered by the Transport Minister this week. To date, 298,000 tickets have been issued, 35,000 more than last year. Interestingly, none of the money goes towards transport, and the Minister wants to change that.
Minister Darrell Vaz wants to hit the jackpot on how to cash out enough money to sustain public education in response to the bedlam taking place on Jamaica's roads, where up to June 20, there have been 194 fatalities.
So the question I ask is, so where is transport? And in fairness, everybody responded and said, that's a good point. There has to be a allocation out of the fines collected that goes specifically to the Ministry of Transport, specifically for road safety. And road safety is not only coming up with nice rhythm and rhymes, it's more.
With 7 fully certified driving instructors now and 27 who are provisionally certified in accordance with the Road Traffic Act 2018 and the Road Traffic Act Regulation 2022, in addition to their teaching skills, the instructors who are rigorously trained to shape behavior and foster responsibility are being encouraged not to fall down on enforcement.
And treat it in a way that you don't operate with a man who is hustling on the side. Then you charge him a money now to go certify someone to go get their driver's license. But that you ensure that the full ambit of the law is followed, but also that you treat the business as something that is not a right but a privilege.
Minister Vaz says it's all about saving lives.
I just want my piece of the pie there. And if I get my piece of that pie, it means that the Ministry of Transport would have sufficient funds to do all that it needs through the National Road Safety Council and the Road Safety Council of the Ministry to make sure that we save more lives. So I'm not sure what I'm going to get yet, but I know I'm going to get a piece of the pie.
Delayed again. The verdict on the matter involving NEPA and Windalco was delayed again on Thursday after one of Windalco's attorneys pleaded with the judge for a new court date. Our reporter Trisha Gay Kelly was on location.
Many companies have called on the National Environment and Planning Agency NEPA to enforce stricter penalties on companies that have breached environmental laws. The agency has responded and has brought the UC Rusal Windalco Bauxite Company to court for fish kills in the Rio Cobre in 2019, 2021 and 2022. The cases, however, have once again been pushed back.
The court ruling for the 2019 NEPA versus Windalco case was scheduled for June 20 and 21. But on Thursday, court ended earlier than expected as one of Windalco's attorneys requested a new date for the ruling. This, as she notes, the lead attorney, King's Counsel Jacqueline Samuels Brown, was on a high-priority case in the Supreme Court. Yet another delay for the long-standing case. However, as the Friends of the Rio Cobre president, Keston Ord Gordon, explains, for the fisherfolk whose livelihoods depend on the Rio Cobre, this is not just another court delay. It's torture.
This matter has been going on now for approximately 5 years. And each time they come and they ask for delay and they ask for delay. And it's a vicious attack on the people in the communities who have been patiently waiting.
Windalco's attorney noted that King's Counsel Brown's Supreme Court case was being drawn out longer than expected, but that statement was countered by a frustrated Judge Alain, who said the very same act was being displayed with the case at hand. She ordered that the case not be pushed into 2025.
They must have consulted with their diary before they convince the court to set the final trial date for today, the 20th, and tomorrow, the 21st. They are not prepared.
Gordon is calling for a special court that caters only to environmental matters. The 2019 case should conclude in November. The 2021 case is set to commence in July, and the 2022 case will continue next month. Trisha Gay Kelly, CVM News.
CVM News at noon returns after this break.
Yet so many do not. We are being intentional about giving prominence to the big stories in order to clarify and enlighten. Lead Story explains who, what, when, where, why, and how. Lead Story with George Davis, weekdays at 6:30 p.m. on CVM TV.
Take your safety seriously. Always wear your seatbelt. A message from the Road Safety Unit in the Island Traffic Authority.
Welcome back. It's now time for our discussion segment. Today, we further ventilate issues in the public health sector. Critics still believe there is disparity in the number of working ventilators in the system. This despite an attempt at clarifying the details yesterday by the health minister. There are also questions as to whether the program for the reduction in maternal and child mortality system, long for PROMAC, is achieving its aims. They ponder how accessible are working ventilators to patients across the country. Well, here to discuss this and other matters in the sector is Health and Wellness Minister Dr. Christopher Tufton. Welcome, Minister.
Hi, welcome. Thank you very much for having me.
Indeed. Well, I know you had a press conference yesterday, and we also heard a bit about the report that was recently done. So from that report, we see that there is at least one working ventilator at the Maypen Hospital. But are there plans to increase that number for the hospital with the proper adjustments for babies?
Well, first of all things are subject to review, and we do review from time to time. But let me give you a context as it relates to ventilators. And while I agree that the targets are moving targets, prior to COVID, we had approximately 30 ventilators in the public health system. Post-COVID, today, we have on average, and I say on average because it changes daily,
yes,
between 100 and 120 ventilators in the system. Now, that's a very significant difference. And as the Chief Medical Officer said yesterday, we have spare capacity, but a lot depends on the demands on the system at any particular point in time, because health works in a particular way where we depend on a system of referrals. So you come back to Maypen Hospital. Maypen Hospital is is a facility that has been a ventilator more for the adult population. It requires trained staff to have ventilators for the neonates and the pediatric population. And as said by the SMO there are plans to install and to get the training done to have a ventilator for that population. However, during this period, what has happened in the past is that the doctors would treat with patients who are vulnerable under a referral process where those neonates in this case would be transferred either to Mandeville or to Bustamante Hospital for Children. Now, in this particular case, which generated some discussion, and we fully appreciate the pain and suffering by the parent, the doctors did administer manual ventilation, which is a routine, it's done a lot, while they were awaited a transfer, which is normally the case, and of course provided medication, but clearly this case, the child who was very ill did not make it, and we regret that. But that should not take away, despite the tragedy of that incident, the fact that we do have a lot of ventilators in the system. They are working ventilators, and even with the downtime for servicing, there is enough to support the demands on the system on a regular basis.
Well, I'm happy you said there is enough, because we want to talk numbers. You mentioned that there were some that were working and some that were to be repaired. Well, in terms of the number of working ventilators, the ones to be repaired, all of that, there seems to be some amount of dissonance in the public. What's causing that?
Because the truth is that it is always a moving target. Yesterday's press brief, the chief medical officer was at pains to explain that what may be the case today may not be the case tomorrow or next week, because these are highly complex, complicated, delicate equipment. They are taken out of service periodically for various reasons, whether it's for infection prevention and control servicing, filter servicing. They are taken out of commission totally at times if they no longer serve the purpose. Sometimes they wait on part. So what we presented yesterday was, as of that date of the end of the audit, was 118 ventilators in the system working, about 40 that were involved in routine maintenance or were waiting parts, and then an additional 50 or so that were to be decommissioned. Now, what decommissioning means is that they would no longer be used. But if you understand how the public health system works, or government works, when an item, whether a bed or a chair, is to be decommissioned and disposed of, it has to go through a very lengthy process. So we gave an audit of all registered ventilators in the system because of the public interest, but we further broke it down into what was being used, what was being serviced, and what was to be decommissioned. And I think the confusion there is that there are assumptions being made that somehow we have more than the amount that we should in servicing. And then, of course, there was a headline that spoke to, dying to breathe or something like that, which suggested that we don't have enough ventilators. And as the chief medical officer said yesterday, we are far better off today than we were pre-COVID in terms of the numbers in the system that are working.
Well, I can understand some discrepancy, because if you had an incident where you needed a ventilator and there was one but you couldn't benefit from it, then perhaps your family wouldn't see it that way. But then, Minister, could you give an estimated time as to how long it will require before these ones that are requiring repair will get back online?
Right, so that also is a difficult question to respond to. If you talk to the technical people, and I'm clearly not a technical person in this field, you will know, or they will say that it depends. It depends on the system, it depends on the make, it depends on what is needed to be done. So, for example, what we have found is that the longest waits are for equipment replacement parts. And that is a problem because suppliers sometimes give all sorts of reasons, logistics reasons, unavailability of supply or manufacturers' parts to delay, that would account for some longer delays. If it's routine maintenance, again, the chief medical officer, I reference her a lot because she's a clinician, said that